And I'm sorry, I will have to start again. So thank you for letting me be a part of this session. It's about approach to ultrasound of common fetal CNS anomalies. As an introduction, the central nervous system malformation constitute the second most common group anomalies in fetuses. Such anomalies have clinical importance as they are associated with high rates of morbidity and mortality, influencing the neurocognitive and motor development of survivors who may have lifelong sequelae. Therefore, it's extremely important to assess the fetal CNS during the prenatal period. Every professional involved in fetal evaluation should be aware of the embryology and anatomy of the fetal CNS. In my presentation, I will have to discuss our recommended views of the fetal brain, which allows us for a systematic approach in the interpretation to reach a more accurate differential diagnosis. So as a start, we have three standard views: the transventricular view, the transthalamic view, and transcerebellar view. This is a collage for the three views. As we can see here, I'm sorry that the marker, I'm sorry, it's the pen, laser pointer. This is our views: the transventricular view, the transthalamic view, and the transcerebellar view. Our first view is the transventricular view. And in this view, we can assess the falcus cerebri, the intrahemispheric fissure, and the fluid-filled structure, the cavum septum pellucidum, and the anterior and the posterior horn of the lateral ventricles. Also in this view, we have to assess the diameter of the atrium of the lateral ventricle, and we have to measure it inner to inner, and its measurement shall not exceed 10 millimeter along the pregnancy. Our second view is the transthalamic view. In this view, we also assess the midline structures, the falcus and the cavum septum pellucidum. Also, we can assess the thalami. And this view is really important in order to have the biometry of the fetus, like the biparietal diameter and the occipital diameter and the height circumference. Our third standard view is the transcerebellar view. When we incline the probe posteriorly, we can see the posterior fossa of the brain. We have here the cerebellum, and the more echogenic in the central is the vermis and the cisterna magna, and of course both thalami. In this view, we have to measure the transverse cerebellar diameter and the cisterna magna, which shall be measured 3 to 10 millimeters. Actually, after we finish our standard views, we can have some extended views, our targeted views, or a special fetal neurosonography, and in some indications, like if you have a suspicion of CNS or spinal malformation, we have a family history of inheritable CNS or spinal malformation. We have a previous pregnancy complicated by fetal brain or spinal anomalies. We have fetus with congenital heart disease, suspected congenital intrauterine infection. Fetal MRI shall not be indicated except if we have some finding from the expert performing the fetal neurosonography. And it's not appropriate to request MRI based only on suspicion of brain abnormality raised at screening ultrasound. Our approach for this extended views will be a transvaginal approach, because it's high resolution and it's targeted examination. We use a transvaginal probe, or if the fetus in the cephalic presentation. If it's a breech presentation, we can use a microconvex probe or high resolution linear probe. This is an illustration of the examination through the transvaginal approach. Actually, the neurosonographic examination of the brain shall be a multiplanar approach. We can use coronal planes and sagittal planes. And we start with the coronal planes. We have a transfrontal, transcaudate, transthalamic, and transcerebellar planes. These are our planes: the transfrontal, transcaudate, transthalamic, and transcerebellar planes. Our first view of the coronal planes is the transfrontal plane. Here we can assess the interhemispheric fissure, the frontal cortex, and the orbits. Our second plane is the transcaudate plane. As well, we can assess the interhemispheric fissure, the frontal horns, the caudate nucleus, and the cavum septum pellucidum. The third plane is in the coronal planes is transthalamic plane. We have the corpus callosum, the frontal horns, cavum septum pellucidum. We can also assist the thalami. Our fourth plane, the coronal planes, is a transcerebellar plane. We can assist the posterior horns of the lateral ventricles, and we can assist the cerebellum, and the more echogenic in the midline, the vermis. We can use a 3D tomography to have various or successive planes from this sagittal view, and we have many coronal planes to assess the fetal brain in coronal successfully. Our second plane in the extended views is the sagittal plane. We are just incline the probe in 90 degrees. We have the mid-sagittal plane and the parasagittal plane. The mid-sagittal plane and the parasagittal plane. Through the fontanelle here, we can, in the midline, the mid-sagittal plane, and para-midline in every side, the parasagittal plane. This is the sagittal or mid-sagittal plane. In the midline, we can assess many structures here. As we can see, we have the corpus callosum, the choroid plexus, the vermis, the quadrigeminal cistern, the fourth ventricle, and the cisterna magna. Actually, we can use Doppler study to assess the vascularity of the brain, especially the pericallosal artery and its distribution. The sagittal parasagittal plane, it's really simple, and we can only assess the ventricles, its body, and the choroid plexus and the atrium. Of course, the parietal lobes or cortex of the brain. أنا قلت ناخد راحة بس كده عشان اتكلمت كتير. Part of the CNS screening is to screen the spine. And here is the spine. We have to assess the integrity, of course, of the skin and the integrity of the vertebrae and the spinal cord. This is a longitudinal view. Other view, we can use the axial views. Here is the cervical vertebrae, the thoracic or dorsal, the lumbar, and the sacral vertebrae. And we have to note that we have an intact skin, and we can note that we have the spinal cord in the midline with a white dot in center. After we have screened or examined the fetus through these planes, we can now show some examples of the fetal CNS anomalies. I will be sharing only some examples and only to illustrate what we have said before. Our first case here is a simple case. We just only have a ventriculomegaly. We have a dangling choroid plexus, and the lateral ventricle is dilated. And of course, you can see that the cortex is sent out. Other case, which is really important, that's a case of Chiari tumor formation. We have many signs here. First of all, the lemon sign of the skull, the banana sign of the cerebellum, and the narrowing of the cisterna magna. That's why it's important to have a transcerebellar view. Also, in the same case, we have a ventriculomegaly in the transventricular view, and we have in the spine longitudinal view a meningomyelocele. The next case, this is a case of lobar holoprosencephaly. We have a monoventricle here and fused thalami. Another case, we can use extended views through a coronal plane and multiple sagittal planes. We have a fused anterior horn of lateral ventricle. This is a case of septo-optic dysplasia, or maybe we can examine also the lobar holoprosencephaly. It's a differential diagnosis for both of them. That's also an important case for illustrating how we use sagittal planes. Here in the axial view, we can see a cystic structure related to the cerebellum. However, when we see the sagittal planes, we can assess the vermis, which we can differentiate it from the Dandy Walker malformations. So this reached about to be the plaque spout cyst, not vermis agenesis or hypoplasia. In this case, we have axial views. We have indirect sign for corpus callosum agenesis. We have colpocephaly with teardrop shape of the ventricles. We have a 3 lines sign, and on color Doppler we can assess that the pericallosal artery is interrupted. Next case, in axial views, we have a cystic structure in the midline. When we apply the color Doppler, we can see a draining vein, which confirms the diagnosis of vein of gallon aneurysm. This is a coronal view of the ventricles. We have cerebral atrophy here. We have dilated anterior horn of ventricles, and we have some calcifications, which confirms the diagnosis of congenital infection. Most common is a cytomegalovirus infection. برضه قلت نريح شويه كده بس يعني بخطف انظاركم عشان القلب بيعمل لكم قلب شويه. Okay, take home message: the systemization of fetal ultrasound examination of the CNS is fundamental for adequate professional training and diagnosis of its malformation. This is my references, and thank you.
Thank you, Dr. Waleed, for this.